Hello folks, we're going to start with muscles again. So this first muscle is pronounced many different ways. If you look it up, and I call it Tensor Fasciae Latae or Tensor Facility, you'll see it pronounced many different ways. So pronounce it however you want to pronounce it. So it's this muscle that runs right here. So if you smack the sides of your legs on both sides, I tell people that they're tense and they smack their face and then they smack their leg. And then you go get a Latae. So Tensor Facility or Tensor Fasciae Latae or Latae. So to help you remember it. So right here. So down both sides of your leg. When you look at this in lab, you'll see it cut away. So what you really see is you see part of that muscle, and you also see part of the iliotibial tract, or the IT band rather. So this muscle right here, we're going to look at several of these. This muscle is pointing to this little part right here, and you kind of have to look because this is you're just seeing part of a model. So you have to look and see what this is. So if you'll look, this is the front of the leg, and this is your side, and then back behind there would be your buttocks. So this is the inside of the leg right here, and there's a little muscle right there. The reason why muscles are so difficult is you have about 640 muscles, and they're all laying on top of each other and intertwined with each other. So that's the muscle they're looking at, and that's adductor longus. In your PowerPoint, it's going to look different because of the way this is cut away. So this right here is your adductor longus. Beside it, you would have adductor magnus, which is more medial. So that's a piece of your adductor longus right there. Then if you look here, this is the inside of your leg right here. And there's this muscle right here, and I call it the gristle. So I just say that so you can help remember the name of it. So this is the gristle in your leg. It's on the inside of the leg. Gristle Gracilis. And if you look here, this is across the leg. So it runs from the outside to the inside. So on both legs right here, this is your sartorius. So I tell students, somebody takes a giant sardine and smacks it across your leg, because you can actually picture that. And I say that because this is called sartorius. All right, we're going to talk about some of the leg muscles that students get confused. So if you're looking here, on the front of your leg, you have a group of muscles. You have 4 muscles in this group, therefore they're called the quads, but the actual official name of that is quadriceps. So you have a muscle here in the middle, you have a muscle here on the inside, you have a muscle here on the outside. So it's hard to see on some of these drawings of this, but here's toward medial side, so toward the middle, toward the midline is this muscle. Then you have this muscle, and you have this muscle, and if you rip this muscle off, you have a muscle up underneath there. So you kind of have to figure out where you're at and what you're looking at first. So this muscle is called Rectus Femoris. That's one of the muscles of the quadriceps. This one is called Vastus Medialis because it's more medial. So Vastus Medialis. Let's look over here for this other one. So this is Rectus Femoris, Vastus Medialis. This one is Vastus Lateralis because it's more lateral. So then if you look over here, they're highlighting just this one. So think about what you think that would be. And you got it right, Vastus Medialis. So here's another little picture of these. So you have Rectus Femoris, Vastus Medialis right here. Then over here you have Rectus Femoris, Vastus Medialis, and then you have Vastus, whatever you think it would be, Vastus Lateralis. So then right here, we've seen this one several times. This one is in the middle, the one they're highlighting. So it would be Rectus Femoris. Then this one, you've ripped off the rectus, is what I tell students. So you've ripped off the rectus here, and what you have here is Vastus intermedius or Vastus intermedialis. So it's in between the medialis and the lateralis, and you've ripped off the rectus, and now you have Vastus intermedius or intermedialis. There's an old song called "Rip Off the Knob and Beat on the Dash." It's an old song about whenever there was actual buttons on your radio in your car. And so every time I say rip off the rectus, I think of that old song, because you're ripping off the radio knob and beating on the dash. Do not know who wrote that song, but I think of that song every time I look at this muscle. We have a few more in this one. So on the back of your leg, you don't have quadriceps, you have hamstrings. Quads are 4, hams are 3. So you've got 3 hams and 4 quads. So if you look at this one is harder for students normally to figure out. So you're going to have this muscle right here that makes up the hamstrings. And this one right here, if you're looking, here's the buttocks, here's your leg, here's the IT band. So this is on the outside, so it's more lateral, and you're asking about this muscle right here. And that muscle is going to be your biceps femoris. It's most lateral, and it's right there, biceps femoris, okay? And then you're going to look at this next one. So if you're looking here, you're going to be looking right here on the back of the leg and the hamstrings. And you're going to be looking right here. And this muscle is semi-tendonosis. And the way that I tell students to figure this out, no matter what model you're looking at, is think tendonosis tethered in between. There's a reason why you have to say it that way. Tethered in between. So if you look here, here's this muscle. You have the biceps femoris on the outside, remember, more lateral. So here's biceps femoris. You've got this muscle over here, which we have not looked at yet. And you've got this muscle right here, which is tethered in between. Tethered starts with a T, tendonosis starts with a T. So no matter what muscle model you're looking at, if you'll think biceps femoris most lateral, tendonosis tethered, it's in between. Tethered will get you the T, which gets you semi-tendonosis. And then this one right here is more medial, so it's not semi-tendonosis, it's called semi-membranosis. So if you look here, this is another one that we're going to look at. So if you're looking right here, you've got this little muscle right here, and that's going to be your adductor magnus, which we talked about before. I hope that helps.